Hi, my name is Olga. I'm going to be performing the skills video of drawing up insulin. I want to start off this video by verifying my orders of the physician and going over the 6 rights of medication. Right patient, right medication, right drug, right route, right time, and right documentation. Next, I want to calculate my dose. So the patient is going to be receiving 4 units of regular insulin and then 8 units of intermediate NPH. It's going to be equalizing for 12 units of insulin. Next, I want to go over and confirm the computer in the HR against MR 3 times before giving any medication to my patient. I'm going to do so the first time here. Supplies here for this video would be a pair of gloves, syringe and needle, 2 alcohol wipes, and cotton wipe if needed. Next, I'm going to, so as I stated before, patient is going to be receiving 4 units of regular and 8 units of intermediate NPH, equalizing 12 units for my patient subcutaneously. I'm going to go ahead and gather my supplies here. I will knock, enter, close the door behind me to avoid any HIPAA violations. I'm going to set my supplies here on a clean, dry surface. And I want to make sure that there's no family members in the room, which there isn't. I'm going to go ahead and hand hygiene and introduce myself to the patient. Hi, Mrs. Smith. My name is Olga. Can I please verify your first name and your date of birth? As she does that, I'm going to verify the wristband. This is going to be my 2 patient identifications. Next, I'm going to educate my patient about her medication. So your doctor, and ask her if she has any allergies. Do you have any allergies? No allergies? Awesome. Second time verifying against MR. All right, Mrs. Smith, so your doctor has prescribed you insulin. You're going to be receiving 2 insulins into 1 injection. The first one is a regular insulin. It is a short-acting insulin. The mechanism for that one is that it draws up glucose from the blood into the cell and uses that as energy to lower down your glucose. Some of the side effects for that would be tachycardia, hunger, and anxiety. Adverse reactions would be tingling of the lips, seizures, and confusion. Please let me know if you have any adverse reactions, and I will let my physician know. The second medication that you're going to be receiving is called NPH, intermediate. It is a longer lasting insulin. Same mechanism for that. The use of it is that it lowers down your glucose levels. It covers like half the day of use, like in the opposite of the regular. A regular only covers 30 to 60 minutes before lunchtime. So the intermediate, we're going to talk about that a little bit more. So intermediate, some of the side effects would be weight gain, water retention, and swelliness. Some adverse reactions would be confusion, headache, and seizures. Please let me know if you have any of these adverse reactions, and we're going to let your physician know. Next, I'm going to go ahead and take my patient's glucose levels, and I'm going to determine the next meal. And I'm going to go ahead and hand hygiene here and put on my clean gloves. And I'm going to verify the 3rd time against MR. Hand hygiene, put my clean gloves on, and we're going to get started. So Mrs. Smith, I just want to let you know also, upon injection, you might feel a little bit of stinginess and burniness. That is normal. when you get an injection. So next we're going to be drawing up the insulin. We're going to start off with the NPH. Before I do so, I'm going to have a nurse here by me. She's going to be verifying the verifying the units in individually, and then we're going to verify against the MAR all together, which is going to be equalizing to 12 units in the total. So I'm going to get started here. So first we're going to draw up air of 8 units of intermediate. I'm going to not draw up the solution. I'm going to push back the air into the intermediate. And then next I'm going to put the air of 4 units of regular, and we're going to push back the air, and then we're gonna invert, and we're going to draw up the 4 units of regular, and then we're going to draw up the 8 units of intermediate, which is going to equalize 12 units of insulin. So first we're going to start by going with the 8 units of air for the intermediate. Eight units of air. Nurse and I verify against the MAR, 8 units of air. Next, before I do so, I want to roll the medication vials. And I want to clean off the tops of medication vials, scar. Awesome. So now we're going to get started. So we're going to start with the intermediate. 8 units of air. Nurse and I verify against the MAR, 8 units of air. I'm going to use take off the cap. Use this for a swooping method later. So we're going to inject the air of the intermediate, not drawing up any of the solution. Next, we're going to get the air of the regular insulin. Nurse and I verify against the MAR, 4 units of air. Next, we're going to inject the air into the regular, and now I'm able to tip it over and draw up the regular insulin. I'm going to tap if there's any bubbles. There's no bubbles. 4 units of insulin. Nurse and I verify against the MAR, 4 units of insulin, of regular. Next, I'm going to tip it over. I'm going to make sure that I'm going to get the NPH of 8 units, sterilizing to 8. I want to make sure that I don't inject any of the regular solution. I'm going to tip it over, use it as a pencil. 8 units. 8 units of intermediate. Nurse and I verify against the MAR. Next, we're going to use the swooping method. Nurse and I verify against the MAR. I 8 or totalizing 12 units of insulin subcutaneously for my patient. As I have all that prepared, and if I was going to get this ready away from bedside, I would label the patient's name here and the dosage amount and document my results. Thank you.